Hi, my name is Courtney. So this is going to be my cardiac assessment. So the first thing you're going to do is introduce yourself to your patient, tell them what you're going to be doing, that you're going to be doing a cardiac assessment, and also to check in their name and make sure you got the right patient, or if you're in a clinical setting, ask their name, birth date, and make sure you wash your hands. So the next thing I want to do is just evaluate my patient, just take a general overlook of what I'm seeing. And right now I see, just to make sure you're inspecting, for me, that nothing's going on, triggers anything for you. Next thing we're going to do is just inspect arms and lower extremities, make sure we don't see any edema, any lesions, any bruising, any swelling, anything like that. So we're just going to go ahead and just do a general overall appearance. Just go down, make sure we don't see anything, which nothing right now is triggering anything. Whenever you're doing that, make sure you're checking for edema. Make sure your patient don't have any edema in their swelling in their feet, ankles, anything around. Next thing we're going to do is look at our patient's nail beds, upper and lower. So you're going to look at the color, the shape of their nails, the angle of them. And then also too, what you can do while you're looking at this is do the capillary refill. So you want that to be less than 3 seconds. So I'm going to go ahead and check his capillary refills. All right, so I'm going to do the lower extremity. Okay, so next thing we're going to do is going to check the other side. And also too, whenever you're doing this, you can check your patient's temperature of their skin to make sure it's okay. We're going to check, make sure, like I said, to see if there's any swelling, edema. Next thing I wanted to do is check the brachial and radial pulse of my patient. Just make sure the rate, rhythm, and contour is good to go, and the amplitude. So you're checking your radial pulse, which is on your thumb side. So I'm going to go ahead and check his pulse. Nice and strong. I'm going to do the other side. Okay, so that's your radial pulse. Next thing I'm going to do is check the brachial, which is up in here. Okay, do the other side. Same thing. Okay, so that was your radial and brachial. So next thing we're going to palpate and check for is the popliteal pulse, the posterior tibial, and the dorsalis pedis. So when you're checking a popliteal pulse, so what you need to do, can you scoot forward just a little bit? So either one, have your patient lay flat on their back, or two, you can have them with their legs over. So what you're going to do is put your hand with your popliteal is back behind your knee, and sometimes it can be hard to feel, which his is good. So we'll move on to the other side. Okay, so we're good there. So next thing, what I'm going to check now is the dorsalis pedis, which is right in the top part of the foot. To the other side. All right, so like I said, that was the dorsalis pedis. So next time we're going to do is the posterior tibialis, which is on the ankle bone behind the mediola. Okay. Which is good. So that's for that. So the next thing I'm going to do for a cardiac assessment, I'm going to check my patient's blood pressure. So I'm going to get me a blood pressure cuff. So you're gonna put your cup on top. Make sure you got your gauge so that way you can see what you're doing. Use this part of your stethoscope to check. So I'm going to go ahead now and inflate my cup. Relax your arm. So we checked our patient's blood pressure. So now what we can do, set that off. So we checked our blood pressure. So now another thing you can do too to check for vascular issue is your ankle brachial index. So usually what you do with them is you check, put a blood pressure cuff on your upper extremity just like I had, and usually you need to use a Doppler. So what you're going to do is, I'll put the blood pressure cuff here back on. So what you're going to do is put your blood pressure cuff on, and then what you're going to do is take a Doppler and put a Doppler right here, and then you're going to inflate your blood pressure cuff up to see when it first pulsates. So you're looking for the brachial pressure. So it's your systolic brachial pressure. So once you get that, so then you go ahead and take that off. And you're going to do it on both sides. So we'll do the other side. So you take the highest of what it is. So you need to do the ankle. So what you're going to do is put a blood pressure cuff on the lower part of your patient's extremity, which is down here. And then you'll check it, use a Doppler on a dorsalis pedis pulse, or you can use on the tibialis, whatever one. So then once you do that, you'll do it on both sides. So then you'll inflate it, get your pressure. So then what you will do is take your your systolic ankle pressure and your systolic brachial pressure and divide it. And normal range for pressure is 1 to 1.40 is your normal. After that, you can have a higher risk for like occlusion or anything like that. So the next assessment that you can do on your patient is called the Allen test. So what the Allen test is, so the Allen test is, you're going to flip your patient's hands over, you're going to have your patient make a fist. You're going to put your fingers on the radial side and on the ulnar side, push on the radial, and then you can feel it come back through for the ulnar. So then you'll do the same thing, you'll occlude the ulnar and put it and see if it comes back and get your thing on the radial side. So that is the Allen test and what you can do on both sides. So the next thing we're going to do is inspect the anterior chest. You're going to check for contour, pulsations, any lifts, heaviness, anything like that. So right now I don't see anything. Everything looks normal. So the next thing what we can do, we're going to inspect the jugular veins. So we're going to do that one at a time. We're going to check for tangential lightening. So your jugular veins, it's here on the side. And we're going to check for carotid pulses too. I don't feel anything. So then the next thing we're going to check is palpate for an apical pulse. So what you can do is have your patient go ahead and lay down. So your apical pulse is, you just go feel right in here and just palpate with your fingers or your palm, which sometimes can be difficult. Okay, so then the next thing we're going to do, go ahead and sit back up. We're going to auscultate and check our carotid arteries. So whenever you do that, you want to make sure you use the bell of your stethoscope to make sure you can hear them good. So I'll go ahead and what you're checking for your carotids is to check for a bruit. Okay. And do the same thing for the other side. Okay, so then, like I said, you also too, like we did earlier, palpate your carotid arteries. Make sure you're not feeling anything. And then we are going to go ahead and do our, listen to our heart sounds. So what you're going to be listening for is S1, S2, and there is 5 points that you need to look for. So, and set up. So we're going to have a listen here. You listen for the S1, S2, so lub dub. And then you're going to go underneath. Close up your arm for a second. I heard all his rate rhythm, and you can also hear the S1, S2, and that is the cardiac assessment.